Okay? Steve, we've been known we never fit right lens on patient's eye. We always fit wrong lens. We always intend to fit wrong.
And then how, you understand how to rectify it. Good. Okay, different kind of topography. I know, Ollie, you have all the stuff, good stuff, including the pentacam at the back here.
Yeah, this one will be in my room in probably 6 or 8 weeks later.
Yeah. I only have that one. Used to have a, no? ISIS, slow it. Yeah. So it's I'm not going to explain in details. That's good. Yeah, that's right. You'll get to know later. I know the slit scanning one. That's the slit scanning types of this topographers. And possibility system. The big possibility system. Right. This is the most important part. As an orthoparatologist, there's 5 display maps which we need to understand, namely the axial map, tangential, refractive power, not so common, elevations, and the difference maps displayed.
We have so many different nationality people here, isn't it? We got Philippines, we got Malaysia, we got Vietnamese, we were Californian from America, Irish, and where else? I mean from Hong Kong, Australia, and Asia as well. So we all speak different language, isn't it? But when we go to topography, that was the map that TC just mentioned, is the map that we communicate, we talk to each other, so we can know, understand what we are doing. So this is something very important for us to learn. The first language called A language, axial map.
What's axial map? Right. So, axial map means that the corneal topography measure the curvature of the cornea with respect to the optical axis. Right? Optical axis.
This is very important when we see what the cornea looks like and the shape looks like. That's a really important map for us to understand the shape and also to design the lens. So Steve always mentions axial map is very important. Don't send him a tangential map for designing lenses, okay? Axial map is very, very important.
And also, you look at the axial map, you know that whether the cornea have the amount of astigmatism.
How many mountains is?
Yeah. Right? Okay, what's next? Axial map. This is our axial map. Let's see map one. Again. Sorry. So, the axial map looks like this. Now, this another thing that I would like to stress. It's the axial map, but 2 different displays. Why? Now, you're going to look at the scale later on towards the end of the lecture.
This is me. This is me.
This you. That's me.
Yeah, I'm very warm.
Yeah. I'm very cool.
No, it should be me. Australia now is winter.
Australia.
You always hot and then.
So, what this blue map shows the same tangential, same cornea, but one is displayed at the normalized scale. So we're talking about 2 different scales, okay? Now one is standard scale, the other is normalized. What is normalized? Well, normalized means that the computer will find the minimum, okay, and the maximum set, and set the color range. So, the warm color represent areas of steeper curvature. In contrast, green and blue color is a cold color, means that the area of flatter curvature.
So most of the time people don't look, they just click, just default at the standard. The standard for MATMO most of the time is 35 to 50. So
this is by default, right? By default,
by default,
35 to 50.
so each cornea has a different max and minimum. So by using normalized, we can understand more about the corneal shape. So in order, especially for the astigmatism, okay, like this, we can see more detail about the corneal astigmatism compared to the standard.
They lost the details.
Yeah, they lost the detail.
So,
We try to squeeze to the range that we can see more detail in the cornea.
so
That is very important when we're doing orthokeratology.
yeah, exactly. So you want to analyze the cornea, use this standard as well as normalized. Right. Tangential, also very, very important.
Second language of orthokeratology,
Yeah.
T language.
Key language. Take a look.
Tangent.
Okay, what the tangential map does is that the computer will measure the corner curvature of each point, okay? Not based on the optical axis anymore, but rather it measures at the point where
Tangent.
it's tangent to a particular point. Okay?
Like Justin talked about the Superman.
Yeah. Straight, and then the Superman hit the ball.
Where the hit.
Superman fly and then just landed on the ball. Big ball, that's the tangent.
Tangent is very important. Tangent is very important. We know where the lens is actually the relationship. It land on the point. So that is something we want to teach you something more about what's the science behind. Not just teaching you how to just fit the lens only. So we want to make you understand from the really basic fundamentals so you can be a really good orthokeratologist. And down the track later, maybe most clearly in your own country as well.
And also in Ortho K, you want to know whether your lens fits properly, the lens fits centrally. You look at the tangential map. Alright? Again, we have normalized tangential map and standard tangential map. See? Yeah, we have that as well. And reflective power, I think we skipped it because this is we use it sparingly. Elevation map, this is so important.
Very important.
Very important. What is elevation? Elevation.
Like he said, we would love the what's the movie we love to watch? No, not Rich King. Titanic.
Oh, Titanic. Okay, now.
So how much the lens actually fly above the air?
Yeah, that's right. Now what actually happened? Seriously, okay?
No, we always
Seriously. What elevation map show you is that the topographic software will calculate this particular cornea and then they will show you the best fit sphere. Okay? The average of all the heights of the cornea, average it, and then it display it in such a way that it shows the color scale.
So most of the time the blue colors is more cooler. So that's why we say more minus. The more watercolor is more high with a reference point on here. So it's not like the blue, think about it, it's going to Australia. Down under, like the ocean. Okay. So if you go to Asia, a lot of mountains is much higher.
Yeah, like you go to in Vietnam is Sapa, yeah? High elevation, and the Red River Valley is
What was the
Delta, Red River Valley Delta. Here's Hanoi, yeah.
So here's is Hanoi and then down south is Saigon.
Yeah, don't get confused with the normalized and standard previous now.
Yeah.
You know, don't get confused. Here, if you look at the elevation map, okay, the blue zone here, the blue area here represents the area lower. Okay, lower than the reference point. Reference point. Okay, whereas the great warm area, we call it, no? Okay, represent the area, okay, above the reference point.
There's a reference point here.
Okay?
So especially when you look at small toric design lenses, sometimes we will, in the more advanced toric design lenses like four zone, quad zone.
Yeah.
So we might encounter some corner with really flat, steep here. Okay, like I mean I would say more flatter here, more steeper than underneath.
Yeah. So this area, the white blue zone here, is different from the blue zone at the top of the cornea. This represents more the deeper color, meaning that the elevation is even lower compared to the top. Okay? So from here you can imagine the cornea shape with respect to the reference point in terms of the cornea height elevation. Right. Difference map. That's also very important. You know, Oli, why it's also important? Because in Malaysia, sometimes I get some new beginners ask me to solve their problem. And then I say, fine, you send axial tangential map in difference map and difference map. No difference. If you don't send me difference map, I'm able to solve professionally. Sometimes I give you wrong advice. Okay? So difference map is very, very important. Now.
So difference map is telling us before and after. So one day TC have some hair, you know what before after. Okay. So like me before was flat and now become a hyperopic defocus here.
So let me show you the difference on that. Okay, yeah, I'll show you the difference.
This is pre in the axial. It's axial map pre. Yeah. And after you post, and you can see some color changes on the cornea. But when we have the difference map, like B minus A, so we can see more detail about how much refractive corrections and a little bit of the red ring, what we call the reverse curve.
The reverse of the steepening zone, okay? But, yeah, that's right. So, this is after treatment. This is the baseline. This exam B, subtract exam A is time.
It's about 1 month, isn't it? Easy, this one.
This is a full body, it's about
1 month.
About 1 month. Also okay, right? Okay? So it's a classical bull's eye pattern.
So this is axial.
Axial.
Let's have a look of the.
Okay, good. Tangential. There you go. Okay, tangential. See, you want to determine whether it's good fit, whether the lens is fitted properly and centrally. Then you look at the tangential. I call it donut rings.
I call it the Lord of the Ring. The Lord of the Ring.
A lot of rings.
Yes.
This is gold color.
I don't like eat sweet TC, you know.
No, I'm talking about California.
Oh, California always love. California always love too sweet. Yes.
Yeah. So in future myopia management, you want to know whether your Ortho K lenses has created enough peripheral defocus. You are going to refer to this.
And this is a different spec as well.
Okay.
So we're so lucky that today we will have some really good design that Steve will bring in. We're going to show you about 6 OCD and 5/4 OCD power corneal change. So which is really effectively, especially when we fit or targeting for low prescriptions patients. We will have a really good fun with the live video. This is how the defocus amount can change within 20-30 minutes.
This is a 6 OCD, the standard Ortho K design. And how do you know the amount of peripheral defocus you created? By looking at the old, this, here. Alright? Now, this is the pupil. I'm going to teach you extra, this one extra. This is a pupil margin, right? Yeah. Now, when some researchers say you have to measure pupil size from the Ortho K machine, from topographers under scotopic condition and phototic condition. Right? Is it accurate?
It depends on what topography you use.
Yeah.
If you use the latest backbone Meridian, basically, it's no way because it's really bright, very bright, really hard to tell.
Okay? And some of the pupil is dynamic, the pupil size is dynamic. So what we can do if you have a backbone, unfortunately we don't have this piece of expensive machines. You're rich. Then all we need to do is to design the lens which has a smaller treatment zone, and also you have to determine whether you have created enough of the defocus amount of defocus by looking at the amount of the steepening zone that you created from here. Okay? Ideally, you're looking for about 3, 4, or 5. 7, the more the merrier.
You can do it instead.
7.
9. I love
This
perfect.
your patient don't complain, huh?
I love perfect.
Okay, that's refractive power map. Let me talk about it. Yeah, okay. Yeah. Okay, good capturing. You want to share? I think we will do it later on. Yeah. So each time when you ask your technicians or yourself doing the capturings from your topographers, there are a few things you need to remember. You know? Calibrate your topographers every 2 weeks. Okay? Then, when you place the forehead, make sure the forehead of patients rest against the band here. Right? So for those who have high nose bridge, nice high nose bridge, you have to ask your patient to tilt your head. If you want to take the right arm, image, tilt to the left, so that the nice highest nose bridge won't block the bias. Also, ask the patient to blink a few times and open it and then to capture it. Why? Because you need a very stabilized tear film in order to get a good image. And get multiple images and average it. Okay? Now, sometimes some people will have smaller lid aperture. Then you may need to slowly ask them to pull the lower lid, and while you pull the upper lid. Ask them to have a few blink and capture the image.
Any more extra tips?
Yeah?
What do the kids need to do before they do the math?
Yeah.
Do you allow them to play mobile phone? Watching iPad?
No way. But they do, you can control it. Parents can control, you can control.
Paul control the parent first.
Okay.
Because in my practice, we definitely let them know is before we take them back, no electronic devices for at least 15 to 20 minutes. Because when even for us, when we look down for 15-20 minutes, our lower lid will push a bit, reshape it of the lower cornea already. This is done by Professor Colin in QUT, Yale University. Okay, Professor Colin, he did studies on downward gazing, changes of the cornea shape. So he already has seen some paper focus for down gazing already will change the inferior part of the cornea. So if we fit in some toric contact lenses, because nowadays we see more kids have toric issues. Okay, maybe weather, maybe rubbing your eyes, maybe watching too much electronic devices. So try to get this to it beforehand. Otherwise, we might measure something unnecessary, induce toricity to the cornea, and then we're affecting how we order the lenses. Okay.
So this four, which one is the best capture of us? That one, okay? Yeah, very easy. Yeah? So you need to have a good, make sure the lid is wide open, then have a wide area of cornea image. the other thing is you get actually topography is not measuring the corneal tissue, the shape of the tissue. It measures a layer of thin tier layer in front